CDC now saying people may only need to quarantine for 7 days, followed by a negative COVID test or a 10-day quarantine without a test. So here to discuss it with us is Dr. Daniel Korytskas, Chief of the Division of Infectious Diseases at Brigham and Women's. Good to see you.
Good to see you.
So this is a little confusing. I think 14 days is that number that we've heard for a while now. Why this change, and is there a risk of virus spreading with a shorter quarantine?
Yeah, I think that's a really good question. And I think it's important for people to understand that, first of all, the 14-day number was based on modeling. And one of the things that we like to do in medicine and in epidemiology is work off the data. New data have emerged, and it's now clear that a shorter incubation period is just as good. And if you combine that with a test that's negative, an even shorter incubation period, an even shorter quarantine period would be just as effective at preventing spread.
So it's good to know this is based on updated data then. All right. Let's talk about Britain approving Pfizer's vaccine for emergency use today. How did they arrive at that decision so quickly? Is their vetting process different than what we do here with the FDA?
Well, it is a different process. Every country has its own approach to regulating pharmaceuticals and vaccines, and the process in Britain is slightly different. For example, when they approve a drug, they only do so because the government is willing to pay for it. That's a very different situation than the United States. It's not better or worse. It's just different, and our process is going to be thorough and exhaustive and safe, and the public can be reassured that when the FDA approves the vaccines, that they're ready for use.
All right, let's talk about the other company in that race. Moderna saying it's going to start testing its vaccine on kids ages 12 to 17. Pfizer has been the only one to start testing on kids as young as 12. Why is this specific testing important, and are these vaccines pending authorization safe for kids?
Well, that's one of the important things we need to learn by doing the testing in children. Pediatricians are fond of saying that children are not just small adults, they're different. They have different immune systems, they have different reactions to things. We need to have data in the age group in which the vaccine will be used, and that's why it's important for Moderna to be extending their study into younger populations.
Okay, so I want to ask you big picture finally tonight. The White House Coronavirus Task Force telling Massachusetts to, quote, consider rolling back a step when it comes to reopening the entire state, not just these high-risk communities. Given today's numbers, 4,600 cases, do you think there is evidence to support that? The governor is saying there's no plan to do that. What do you think?
I think that's a tough question. The issue is you'd like to focus the efforts where the incidence is highest, but then you do risk people in areas that are being shut down migrating to areas that are still open to go to restaurants or shop, and that would be the rationale for having a wider shutdown. But I do think that's a decision that needs to be made at the state level.
Okay, on a local basis, again, to your point, based on data.
Based on data,
yeah.
Absolutely.
Okay, Dr. Korytskas, thank you for your time. We appreciate it, as always.